You've provided excellent care to your home health patients, paid your staff, and covered all your operational costs. But now you're stuck waiting and waiting for reimbursement checks that should have arrived weeks ago. In the next 5 minutes, I'm going to show you exactly how long home health reimbursement actually takes, what's causing your payment delays, and the specific steps you can take to get paid faster. Here's what most home health agencies don't realize. Every day your claims sit unpaid isn't just a minor inconvenience. You're essentially providing free loans to insurance companies while your own cash flow suffers. And when reimbursement extends beyond 30 days, you're facing immediate cash flow challenges that can trigger operational crises. Let me break down the real timeline you're dealing with. Medicare typically processes clean home health claims within 14 to 30 days from submission. Sounds reasonable, right? But here's the catch. This only happens when you have perfect documentation, accurate coding, and no documentation requests. The moment Medicare requires additional information or decides to audit your claims, you're looking at 60 days or more. For most home health agencies, Medicare represents a huge portion of revenue, making these timelines absolutely critical for cash flow management. Claims submitted with missing OASIS assessments, incomplete physician orders, or documentation gaps face immediate delays. Now, Medicare Advantage plans are a different story entirely. They typically take 30 to 45 days to process claims, with some extending to 60 days depending on the insurer's internal processes. But the real challenge with Medicare Advantage isn't just the longer timeline, it's the unpredictability. While traditional Medicare follows standardized processes, each Medicare Advantage plan has unique requirements that can catch agencies completely off guard. Medicaid reimbursement varies dramatically by state, but you're generally looking at 30 to 90 days. Some states process claims faster, while others consistently push beyond 60 days. This becomes especially problematic for agencies serving high Medicaid populations because those payment delays can seriously strain cash flow. Private insurance timelines vary just as widely, from 15 days to 45 days or more. However, private payers are increasingly implementing utilization review processes, prior authorization requirements, and medical necessity reviews that extend reimbursement timelines significantly. But here's where it gets really expensive. When reimbursement extends beyond 30 days, you've already paid caregivers, covered transportation costs, and invested in supplies. Every additional day claims remain unpaid, increases your accounts receivable, and strains working capital. Agencies with high accounts receivable over 90 days often experience severe cash flow problems that delay payments to staff and vendors. These extended reimbursement timelines frequently force agencies to rely on lines of credit or factor receivables. Interest expenses of 8 to 12% or more directly reduce your profit margins, eating into revenue you've already earned. You're essentially paying to wait for money that's rightfully yours. So what's actually causing these delays? Let me walk you through the biggest culprits that home health agencies face every single day. OASIS assessment accuracy is absolutely critical for home health billing. Medicare reimbursement relies heavily on OASIS data for case mix adjustment, so incomplete or inaccurate OASIS assessments trigger immediate reviews and delays. This isn't just about getting the assessment done, it's about getting it done correctly the first time. Physician certification issues halt claim processing immediately. Missing or incomplete physician certifications are claim killers. The 60-day episode structure requires precise timing and documentation to avoid payment delays, and many agencies underestimate how strict payers are about these requirements. Clinical documentation quality makes or breaks your claims. Progress notes, nursing assessments, and therapy documentation must clearly support medical necessity. When documentation doesn't demonstrate progress toward goals, payers request additional information, extending your reimbursement timeline significantly. Coding errors are another major delay factor. Home health agencies using ICD-10 codes that don't align with OASIS assessments face routine denials. Primary diagnosis coding errors particularly impact case mix payments, affecting both reimbursement amount and timing. Prior authorization failures create massive delays. Medicare Advantage plans and some private insurers require prior authorization for certain services. Failing to obtain proper authorization before service delivery results in claim denials and extended appeal processes that can push reimbursement out months. But here's the good news: agencies that understand these issues and implement systematic solutions can dramatically reduce how long home health reimbursement takes. The fastest paying agencies focus obsessively on first pass claim acceptance by implementing quality checks before submission. Clean claims, those accepted without edits or requests for additional information, typically process within standard timelines. They establish systematic OASIS review procedures to catch errors before claim submission. They use automated coding validation tools to ensure ICD-10 codes align with clinical documentation and OASIS assessments. They verify insurance benefits in real time before each episode to eliminate coverage surprises that delay payment. Modern billing systems can automate claim submission, track payment status, and identify patterns in reimbursement delays. This technology enables proactive management rather than reactive problem solving, which is exactly what you need when cash flow is tight. The most successful home health agencies combine operational experience with data-driven insights. They understand which payers consistently delay payments, which documentation elements trigger reviews, and how to structure claims for optimal processing speed. This operational knowledge becomes particularly valuable when managing cash flow because experienced billing teams can predict which claims will pay quickly and which will face delays. Here's something many agencies discover too late: internal billing operations, while seemingly cost-effective, actually extend reimbursement timelines and increase write-offs. The hidden costs of delayed payments, denied claims, and administrative overhead often exceed the investment in professional billing services. When billing companies combine deep operational experience with powerful data analytics, they can significantly reduce how long home health reimbursement takes. The key is finding billing services that understand the specific challenges of home health reimbursement and have the resources to work every claim aggressively. How long does home health reimbursement take ultimately depends on your billing processes, documentation quality, and ability to navigate payer-specific requirements. While standard timelines range from 14 to 60 days or more, agencies with optimized revenue cycle management consistently achieve faster payments and better cash flow. The financial impact of extended reimbursement goes far beyond delayed cash flow. It affects your ability to grow, serve more patients, and maintain operational stability. Focus on clean claim submission, systematic follow-up, and operational excellence to minimize the time between service delivery and payment. We'll analyze your current reimbursement patterns and show you specific opportunities to accelerate cash flow while reducing revenue cycle delays. Contact us today for a free consultation and let us help you streamline your home health billing process. Don't forget to subscribe for more home health billing insights. Drop a comment about your biggest reimbursement challenges and check out our next video on optimizing your OASIS assessments for faster payments.